Hello friends, today we are going to learn about sepia drug picture. Sepia's common name is cuttlefish. The cuttlefish looks like this and it has many special features. One of it has ink stores and this ink can be ejected to create a smoke screen or a smoke illusion in which the cuttlefish can escape from the enemies. This ink of the cuttlefish is taken and potentized medicine is prepared from it. Let's look into the pathophysiology. Sepia especially acts on portal system, which means a blood vessels which start with capillary system and end in capillary system. Because of this, there is a irregular blood circulation. In some parts, there is venous stasis and venous congestions. Because of this stasis of blood at one place, there is weakness and weariness in the visceral organs. And if the patient moves vigorously, the circulation is distributed evenly or normally and the patient starts feeling better. Here comes our first symptom of sepia, dancing amelioration. It is not specifically dance but any movement which involves the whole body and brings back the circulation to normal. So the first symptom is a dancing amelioration. Now let's see the constitution. Sepia is suited to tall, slim women. She looks like a male. She has no curves. She is very tall, slim, narrow, straight from the shoulder all way down. The pelvis of sepia is narrow like a male pelvis and it is not good for childbearing. So there are frequent abortions in sepia. Mind. The mind of sepia has a lot of symptoms. The most important is indifference, which means lack of interest or lack of affection. Sepia patient used to be very loving and caring, but now she has no affection and she does not react to any love shown, not even to her own children and husband. She says, I used to love my children and husband, but now I have no feelings on them. There is no joy, no affection. Sepia is not an indifferent woman since birth. She used to be happy, affectionate, doing household work, but something happens in her life which turns her totally to a different woman. This different woman does not want to work or do any occupation. She is easily offended and she basically do not feel like doing anything, either playing or working. So what can be this something which happened in her life? This something can be maybe some uterine or hemorrhagic disorders in her body, maybe due to the nursing, because of nursing her over vigorous child or twins who require much milk. It may be due to over vigorous husband with over sexual excitement involving in sex for more times. So anything can be happened in her life. Only few examples are mentioned here. It can be anything. It can be like overworking for her husband and child, over involving in household works, etc. So after this she reaches a threshold point or a breakdown point where she turns herself into an indifferent woman who does not react to any kind of affection. This sepia patient is usually anemic. She has yellow blotches on face, saddle-like brownish distribution on nose and cheeks. Usually it is called as telltale face. Telltale face means by looking at the face we feel like the face is telling a story. Here in this case of sepia it is telling a story how she suffered or how is she suffering in her life. So, being anemic, she has pale lips and ears. Fingers and hands become shriveled, which means wrinkles, and person looks like prematurely old. As it is predominantly a female remedy, let us talk about the female symptoms. Sepia is mainly a female remedy, but we can also give it to male if the symptoms of sepia are present, which are at mostly mental level. So, coming back to the female symptoms of sepia, tide of sex, aversion to opposite sex. The menstrual flow is of all sorts. From provings and clinical observation, it has cured profuse as well as scanty flow, menorrhagias, metrorrhagias, etc. So, sepia consists of all types of abnormal menstrual flows. Here we should consider the mental symptoms while prescribing. Second, pelvic organs are relaxed. We already discussed why they are relaxed, because there is stasis at one place. Because of this venous stasis, the organs become weak and they are prone to prolapse. Bearing down sensation as if everything would escape through vulva. So, a sepia woman always crosses her limbs while sitting. She feels that she can prevent the protrusion feeling by crossing her limbs. Sepia can be given in prolapse of uterus and vagina when all the symptoms collide. Morning sickness of pregnancy. The sight or the thought of food makes her sick. Nausea and vomiting even from the smell of cooking food. Now let us discuss other important symptoms of sepia. First one is sepia is a very chilly patient. We already discussed in the previous that sepia is anemic. Because of being anemic, there is lack of vital heat, and because of lack of vital heat, she gets chilly so easy. So she is a very chilly patient. Second point, all the pins of sepia uh, go from below to upwards. Third one, there is ball-like sensation in inner parts of the body, like ball-like sensation in anus, ball-like sensation in abdomen, ball-like sensation in head. Everywhere there is a ball-like sensation or an all-gone sensation in sepia. Fourth one, sepia is called as washerwoman's remedy because the complaints are brought up or aggravated by laundry work or washing clothes. Fifth, pain extends from all parts of the body to back. So wherever the pain may start, it will end in the back. Vertigo after getting wet from extremes of cold or heat, riding in a carriage while kneeling in the church. In order to remember this, just imagine a woman in a cold, snowy day, riding in a carriage, goes to church. While going, she gets wet because of the snow, and imagine at every step she gets vertigo. So, we get vertigo of sepia, that is, from extremes of cold or heat, after getting wet, riding in a carriage, while kneeling in church. Seventh symptom, constipation almost in every complaint, even in pregnancy. Eighth, headache in terrible shocks at menstruation with scanty flow, aggravated by motion or mental labor or stooping, ameliorated by external pressure. Great falling of hair even after chronic headaches or at climacteric or while reaching menopause. Ninth, skin. Herpes cercinatus or tinea cercinatus in isolated places or isolated parts. Itching not relieved by scratching. mostly worse in bends of knees and elbow. Ringworm like eruptions every summer. Artricaria ongoing in open air and better in warm. Now coming to general modalities. Aggravation. Washing, laundry work, cold air or cold weather, sexual excess, at rest and at thunderstorm. Amelioration. Because of being chilly patient, she is ameliorated by hot application, warmth of blood, dancing or exercising. Relationships. Complementary Sepia is complementary to natrium mure and phosphorus. Nux vomica intensifies the action of sepia. Guacum is often beneficial after sepia. Sepia is inimical to pulsatilla and lachesis, so it should not be given before or after pulsatilla and lachesis. So this is direct picture of sepia. The main indication of giving sepia are mental symptoms. In cases where mental symptoms matches sepia does wonders. Thank you for watching. Please comment down below which remedy do you want next and please share it with your friends. Thank you.